All right, well, if you're planning on having a baby soon, you may be considering a midwife. Now, here to talk to us about that today, Ann King, a certified nurse midwife with Coastal GYN Specialists Midwifery. Did I get that right? Midwifery?
Midwifery.
All right, well, see, if you do wifery, it goes back to my roots of doing sports, baseball. See? You brought it all together. All right, so I was saying that I think right off the bat, no pun intended, a lot of people, I don't even think understand what a midwife is. So for those of us who are kind of confused by that, what is a midwife?
A midwife is an advanced practice nurse with a graduate degree that's had medical training to provide healthcare services for women throughout their lifespan.
What are some of the services that you then provide?
The services are comprehensive. We provide preventative and wellness care. We do family planning, birth control, prenatal care, deliveries at the hospital. We do cancer screenings for females.
When a woman is at the point where they realize they're pregnant, how soon does a midwife come into play after the initial, hey, congratulations, you're pregnant?
We come in right away, conception to birth and postpartum. Go through the whole process.
Do you find that midwives are maybe more inclined to be brought in by a first-time mother? Or is this something that you even see with mothers that have multiple children, maybe opt to do this each time?
I think we get a good mix of both. We combine thousands of years of experience with modern technology, so the woman gets the personalized, safe, healthy birth experience that she needs and wants, and so we have lots of educated women who go out there and see. We've been doing this for a long time, and women who've been with us through 4th and 5th babies and keep coming back.
One thing I want to ask you about really quickly is I know a lot of women after the fact, the postpartum depression comes in. How much do you come into play with aiding and helping a woman get through that?
We start from the very beginning when they, come to us pregnant, talking about the risks of postpartum depression and ways to alleviate those risks and the signs to watch for, and we're educating them throughout the entire process. Even through the birth at the hospital and during their postpartum visits.
Yeah, and I always say that if you ever have questions about anything that we talk about here, this is who you want to, don't email me. I'm not a midwife, obviously, but you always want to go to the individual that knows what they're talking about, which isn't me. It's always the person that is a card-carrying member.
Right.
To talk about
Nationally board certified.
I appreciate it, Ann. I told you, painless.
Thank you very much.
We're back after this.